Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them like shooting fish in a barrel. Today's discussion focuses on the rabies virus, a preventable but deadly infection that still claims thousands of lives every year. Before we start, take a plunge into these questions. Which organ system does the rabies virus primarily target? How does the location of the bite influence the incubation period and disease progression of rabies? Name at least 3 clinical features typical of encephalitic rabies. Keep watching. The rabies virus belongs to the Lyssavirus genus of the Rhabdoviridae family. It's an enveloped, negative sense, single-stranded RNA virus. The virion is bullet-shaped and has a helical nucleocapsid that protects the viral genome. The outer envelope is studded with G-glycoprotein spikes, which allow the virus to bind to host receptors, especially at neuromuscular junctions. This structure makes the virus neurotropic or nerve-loving, allowing it to spread fast through the nervous system. The virus uses several powerful virulence tools. Its G-glycoprotein binds to nicotinic acetylcholine receptors at the neuromuscular junction, letting it enter the body. The P protein helps it evade interferon, while retrograde axonal transport carries it straight to the brain. The rabies virus strongly prefers nerve cells, so it spreads quickly through the nervous system. Transmission usually happens through bites from infected animals like dogs or bats, or through saliva contact with broken skin. Rarely, it spreads through organ transplants or lab exposure. People at greatest risk include unvaccinated individuals in endemic regions, animal handlers, spelunkers, and travelers. Globally, rabies produces tens of thousands of deaths each year, mostly in Asia and Africa, where dog vaccination is limited. Incubation lasts 1 to 3 months, but can be shorter if the exposure site is closer to the brain. The early or prodromal stage presents with fever, malaise, and tingling or pain at the bite site. In the acute neurologic phase, patients may develop the encephalitic form, meaning the brain is inflamed, showing agitation, confusion, hydrophobia, hypersalivation, and aerophobia. Others develop the paralytic form, which causes weakness and flaccid paralysis. Coma and death follow within 1 to 2 weeks of symptom onset. Complications include fatal brain inflammation, respiratory failure, and unstable vital signs. Mortality is nearly 100% once symptoms appear. Rabies has no known cancer link. Diagnosis of rabies can start with clinical suspicion, especially in patients with neurological symptoms and a bite history, but laboratory tests are necessary for confirmation. Negri bodies or pink inclusions in nerve cells may be found on biopsy or after death. Reverse transcription polymerase chain reaction can find the virus in saliva, spinal fluid, or skin samples. Direct fluorescent antibody testing may be done on skin or corneal impressions. Serology detects neutralizing antibodies. Treatment depends on timing. Before symptoms appear, post-exposure prophylaxis, including wound cleansing, vaccine, and immune globulin, can prevent disease. After symptoms manifest, care is supportive only, and survival is rare. Rabies is highly preventable. Effective measures include vaccinating pets, wildlife control, pre-exposure immunization for high-risk groups, and prompt wound care plus prophylaxis after exposure. Other Lyssaviruses can also cause rabies-like illness in humans and animals. These include species found in bats across Europe, Africa, and Asia. Though less common than classic rabies, they highlight the importance of broad surveillance, vaccination strategies, and awareness beyond just dog bites. Let's go back to our questions. Which organ system does the rabies virus primarily target? Answer: the nervous system. How does the location of the bite influence the incubation period and disease progression of rabies? Answer: the closer the bite is to the brain, the shorter the incubation and the faster the symptoms appear. Name at least 3 clinical features typical of encephalitic rabies. Answer: agitation, confusion, hydrophobia, hypersalivation, and sometimes seizures or paralysis. Did you get 'em all? Great going! If this video made the rabies virus easier to learn, hit like, share, and subscribe. Check out the summary table from the link in the description. Thanks for watching. Catch all of our rapid-fire medical lessons here on Med in 5.